What is a speech pathologist? There are many perspectives on what this job title incorporates. Different views arise from different groups of people, such as the clients, the caregivers like the parents, society, the speech pathologists themselves, and other health professionals. The competency-based occupational standard states in Principle 4, interprofessional practice is a critical component of competence for an entry-level speech pathologist. This is the involvement of different professions to work collaboratively together in order to bring a more holistic approach to the health system. We aim to portray a strong definition of the speech pathology practice for health professions, so we can therefore collaboratively work together and pursue a holistic approach to the healthcare system. So what does the speech pathology practice involve? Speech pathologists understand that communication is an important tool that is used amongst every human being, and a dysfunction in this tool can lower the quality of life for that individual. Speech pathology targets communication and swallowing disorders amongst any age group, using a number of different approaches to their practice in order to increase the quality of life. Speech Pathology Australia has set out 7 necessary competencies expected in speech pathologists. This is known as the Competency-Based Occupational Standards, developed in 2011. The first step is an assessment, where the speech pathologist will find the main concerns of the client. The ICF, which is the International Classification of Functioning Disability and Health, is a framework that helps speech pathologists to provide quality, efficient, and effective service towards their clients. The ICF is a conceptual framework that recognises that an impairment of an individual can impact the functioning of the individual's lifestyle, which includes areas such as social, environmental, active and participatory influences. The ICF aims to classify and describe the elements of health and functioning in order to support health funding along with intra and inter professions, creating a universal understanding amongst areas involved in the healthcare system. The second area of competency is analysis and interpretation. COMPASS is a tool used by speech pathologists. It's developed by Speech Pathology Australia and gives an assessment for speech pathologists to follow for correct clinical reasoning. From this analysis and interpretation, strategies can be discussed and determined by the client and the speech pathologist. Speech pathologists assure that their work and practice is informed by evidence-based research. Keeping up to date with the most recent research, it must be clear, sensible and reliable information. This academic research is then intertwined appropriately with the patient's needs and values in order to follow the ICF framework. So now appropriate domains of the speech pathology practice can now be implemented. Speech pathologists are required to plan, provide and manage. This component involves the competency to follow regulations within their practice, such as health and safety regulations and organisational skills. It's also the ability to seek help from other speech pathologists along with other professional services. In order to have a professional practice, the ability to maintain professional relationships is required by speech pathologists. Disorders within communication and swallowing. The first area is language. This could include cognitive and social communication. Then there is speech. This can involve problems in production and articulation. Swallowing includes dysfunction of eating and or drinking and dysphagia. The voice can become affected when there are problems with the larynx, and fluency can be affected by stuttering. Multimodal communications can be implemented as assistive technology. Speech pathologists understand the importance of communication and how it can affect one's quality of life. The speech pathology practice is a dynamic profession that is continuously evolving, and by using appropriate frameworks, Speech pathologists can bring the most effective and efficient service to clients with communication and swallowing